Thank you for tuning in to this session to learn more about the kidney transplant process at the Washington University and Barnes Jewish Transplant Center in St. Louis, Missouri. During this session, we will be reviewing the role of the transplant financial coordinator and the transplant social worker at our center. Both of these specialists play a critical role in the evaluation process. All patients undergoing evaluation for kidney, pancreas, or pancreas transplantation at our center will have candidacy determined based on a standard set of selection criteria and approved indications for kidney, pancreas, or pancreas transplant.
Prior to scheduling a transplant evaluation, insurance information is obtained. Transplant benefits are reviewed by the transplant finance team to ensure that a patient's transplant can be paid for. There are a few possible outcomes of the insurance review. The best possibility is that the insurance company approves the evaluation. An insurance company may request additional clinical information prior to giving authorization to proceed with a transplant evaluation. Our office will obtain the needed information and forward it to the insurance company for review. An insurance company may decline approval for transplant evaluation at Barnes Jewish Hospital because they use a different transplant center. If this happens, the financial coordinator calls the patient to review this information with them. During the transplant evaluation, each patient has a consultation with their transplant finance coordinator. This consultation is scheduled just like all of the other evaluation appointments. During the consultation, costs associated with transplant, including medication costs, will be discussed. Any changes that may occur following a transplant are also reviewed.
Patients who have Medicare as a result of dialysis are educated about the termination of Medicare that takes place 36 months after transplant. This impacts how a patient pays for medication, which is critical for long-term success of a transplant. Patients who are under the age of 65 with Medicare are counseled to develop a plan for employment after transplant. Transplant is not considered a disability, so any disability benefits related to dialysis will also go away after transplant. This includes transportation support and chore workers, for example. The relationship between a patient and the finance coordinator doesn't end when the evaluation is complete. It's critical that patients alert their financial coordinators of any changes to their insurance coverage. Since each insurance company has their own rules, any change in insurance requires that our office obtain authorization for transplant. Patients can avoid the frustration of being called in for a transplant and then being sent home due to insurance changes by keeping us up to date.
Let's review some case examples to illustrate how a financial coordinator assists with the evaluation process. Number 1, Medicare and no supplement. A 66-year-old female on the wait list has been called in for transplant. As part of the pre-transplant screening, the financial coordinator rechecks the insurance coverage we have on file from listing. The team has the patient registered with Medicare primary and UHC secondary insurance. Upon re-verification, it is found the UHC secondary plan termed a few weeks ago, but the patient explains that they have a new secondary plan that they forgot to tell the team about. At this time, the patient does not have transplant authorization for their secondary plan and only has Medicare coverage for transplant. The team must halt the transplant process now while authorization with the new secondary plan is secured. Medicare alone is insufficient coverage for transplant, as there will be a 20% gap in coverage for critical transplant needs, such as the transplant surgery, outpatient follow-up, and immunosuppression medications.
2. Medicaid with high spend down. A 52-year-old male on dialysis is undergoing evaluation for transplant. The financial coordinator finds the patient has Medicaid coverage, but with a $900 spend down. In discussion with the patient and their family, it is found that the patient is unable to meet their spend down reliably. The patient is counseled regarding their personal financial situation, given tips on submitting medical bills to meet the spend down, and referred back to the dialysis center for their social worker and finance team to further assist. Ultimately, the patient must be able to reliably meet the spend down or have alternative coverage to ensure adequate coverage for transplant. If the patient can qualify for Missouri Kidney Program, they typically can move through since MOKP will cover costs of anti-rejection medications. However, since the plan will not show active until the spend down is paid, we cannot request transplant approval until then. MOKP will pay the spend down only one time per year, so we have to wait until the spend down is paid, either by the patient or MOKP, before we can request transplant approval. If the patient is from Illinois and on Illinois Medicaid, the patient is responsible for paying any spend down as Illinois has no assistance programs available.
Third case, private insurance. A 46-year-old female is referred for transplant. Prior to evaluation, the financial coordinator assesses insurance coverage to ensure the patient has a contracted plan. The coverage is found to be contracted with our facility, but the patient has a $10,000 deductible. During the evaluation, the financial coordinator counsels the patient to find out that they have some ability to pay, but there are a number of concerns about how well this will work. Instead, the financial coordinator advises the patient to fundraise with their family. They set a goal together and discuss ideas for strategy. The patient stays in communication with the financial coordinator regarding progress towards their goal. The team agrees that the patient understands their financial responsibilities and has a good plan in place to ensure it's met. Thus, the patient is listed for transplant after medical clearance.
As part of a transplant evaluation, a consultation is scheduled with a transplant social worker. The social worker will give each patient the opportunity to discuss his or her feelings about transplant openly and will listen to them without judgment. A transplant social worker evaluates a candidate's insight into their disease compliance with medical advice and treatment, social support systems, housing and transportation, and a candidate's ability to follow complex instructions and care regimens. The social worker is an important resource to the patient prior to and following transplant.
Let's review some case examples to illustrate how a social worker assists with the evaluation process. Case example 1. Mrs. Smith is a 60-year-old female that lives in Florissant, Missouri. Mrs. Smith initiated hemodialysis 6 months ago and has not missed a day of her dialysis treatment. Mrs. Smith has good insight into her kidney disease and recognizes the importance of being compliant with her medical treatment. When discussing post-transplant care, Ms. Smith reports that her husband will be her primary caregiver support person as he is retired and in good health and will have adequate availability. In addition to her husband, patient reports that her daughter is a significant support in her life and lives 10 minutes from her and will also be involved in her post-transplant care and support. The patient fills her weekly pill box by herself each week and denies missing any medication. The patient was able to recall her medication with ease, provide assessment information independently, and her husband was present and supportive.
Case example 2. Mr. A is a 45-year-old divorced male that lives in Springfield, Missouri. Patient has been on hemodialysis for 10 years. Patient has been compliant with his dialysis treatment and denies issues with remembering or organizing his medication. Patient has been receiving Social Security disability income since he started dialysis 10 years ago. Patient is only considered disabled due to his kidney disease. Patient has Medicare A and B and Missouri Medicaid. Patient has not worked in 20 years and reports to social worker that he does not plan on working post-transplant as he does not have much work experience and is not sure what he would do. Patient's highest level of education is high school. Social work explained to the patient that if his disability is only due to kidney disease, he will likely lose his disability and Missouri Medicaid 1 year post-transplant, and he will lose his Medicare A and B 3 years post-transplant. This means the patient will be without income and insurance 3 years post-transplant. Social work recommended the patient participate in vocational rehab to obtain job skills and training so that he will be able to find a job with insurance benefits post-transplant so that he will not have trouble affording his anti-rejection drugs or follow-up labs and clinic visits.
Case example 3. Ms. B is a 68-year-old female that lives in St. Charles, Missouri. Ms. B attended and completed the psychosocial assessment alone. During the assessment, the patient reports that she misses dialysis 4 to 5 times a month due to transportation issues. The patient is legally blind in her left eye and therefore relies on her niece to take her to dialysis. The patient's niece works full-time and has 3 children of her own. The patient states that her niece is the only support person in her life and she is not married and has no children of her own. Additionally, the patient expresses concern with adding medication to her regimen post-transplant as she frequently forgets to take her medication now, even though her niece fills her pill box for her. When social worker asked about the patient's medication and if she was taking any anti-anxiety or depressant medication, the patient was unsure as she is not familiar with the medication that she takes.
There are a myriad of scenarios related to finance and social work that a patient may experience. We hope that you have enjoyed this presentation about the role of the financial coordinator and the social worker in the evaluation for kidney transplant at Barnes-Jewish Hospital. There are 3 other presentations available: the kidney transplant evaluation process, living kidney donation, the waiting list and being called in for kidney transplant. We hope to see you again soon.